said, these are sort of my preparation tips that I've tabulated from talking to a number of people through the RLO roles generally, sitting the exams. I think don't get overwhelmed. And I think there's a big temptation with the KFP especially to sort of be like, oh, I know the answer to that question, but I don't know the answer that RACGP want me to give. If you know the answer, that's you know the answer. And at the end of the day, the pass mark is set at, what did I say, 53 to 56%. So you really only need to get just over half the questions right. So if you know 3 out of 4 differential diagnoses for a condition and you're not sure about the 4th one, you know, just put something down. But if you've got 3 of them right, that's a good odds, you know. And I think that's a really important tip in the exam. So I know that, as I said before, it's definitely a barrier exam. There's certain questions in the exam that are purposefully difficult, both in the AKT and the KFP, and those questions are to differentiate the top candidates from the next level candidates. There's going to be questions that you just don't know what they're asking about, and you might feel like, yeah, you've got none of that whole question right and you've missed 1 in 26, but that might be the question that's trying to separate the top 10% from the top percent. And the aim of the game is to pass, so you don't need to worry about being in that top level. If you don't know the answer, you've just got to move on, and you just can't let yourself get sort of beaten down. And same when you're studying, like having a breadth of knowledge is great. That's what all GPs want, but it is difficult to get there. You can't possibly know about everything, and you can't sort of waste your time stressing about not knowing about everything. I think trying to, as best you can, you know, broaden your knowledge, limit the depth that you're researching into conditions to a GP level. And there's some things you obviously need to know more about, you know, diabetes and high blood pressure and cholesterol, you know, they're bread and butter GP stuff. But yeah, I know before reading the exam of Huntington's has come up, and Addisonian crisis, and what did I read, myasthenia gravis or something. They're all very uncommon conditions. But when you read what they were trying to ask about, they're not asking about, you know, the pathophysiology of Huntington's chorea. They were asking about genetic screening. Can't remember the other examples they came across, but when they have difficult conditions that they've given you, they don't want, you know, in-depth medications to treat it with. They want to know that you know sort of that could be a differential diagnosis for a patient presenting in their mid-40s or 50s with some abnormal movements and dementia. Could be Huntington's, but they don't expect you to know, you know, exactly what test to diagnose it and how to treat it, because that's a specialist level. Something that's probably been talked about a lot is finding out your weaknesses and focusing on these. So if you're someone who does shared care and GP, don't spend any of your time reading about pregnancy. Spend your time reading about men's health, because more commonly you're not going to come across that. And that's obviously a big focus area of GP these days. And again, if you're someone who really likes seeing children or does a lot of aged care work, and so you're really good at geriatrics and driving medicals for the elderly and chronic disease management, then make sure you know your paediatrics and make sure you know your women's and men's health and your adolescent health and that kind of thing. In your study groups, I think either from now or if you're just starting to form one, make sure that you use them to practice your clinical reasoning. So rather than just sharing a bunch of information with each other, make sure you're asking each other questions. So if the topic for the week is, you know, pediatric respiratory illnesses, make sure that you can create a sort of a KFP question out of that. So, you know, just it's pretty easy off the top of your head. You're never going to get it exactly like they asked them, but you've got a 4-year-old kid who you hear in the waiting room with a bark-like cough. The first question may be, you know, what is the most likely diagnosis? And the second question may be, what are 4 pieces of advice that you can give to mum for managing this condition? You know, so you don't need to know exactly the severity and how to, you know, all the markers of the mild, moderate and severe. You do need to know that you would give them steroids, and you do need to know how long you'd watch them for. But in a practical sense, what would you actually say to mum about managing a kid with a bark-like cough? And so practice that with each other. Use your patients from day-to-day clinical practice. And, you know, even if each of you, or if you're just a pair, you know, make up a few KFP type questions to ask each other as you're going through your study group, I think that really gets you in the mindset. And if you have time, then using the exam reports can also be useful as well. I know RACGP recommend them a lot, and I've definitely read through them. They do take a lot of time to wade through, and I guess the risk is they don't seem to repeat a lot of questions. So I don't think they're going to get another Huntington's question anytime soon, so it's probably not worth studying a lot about it. But I think getting an idea of the types of questions they may ask. So that diet one in pregnancy, you know, like I feel like I know a lot about pregnant women, and still I would probably struggle to come up with a good answer to that question. And so for me, that's a good learning area, and going back and remembering what practical advice to give, and how to sort of translate that into an answer for a KFP question. And that's where the exam reports can come in handy, I think. But there is a bunch of them now. I think they've gone from 2013, 14 or 15 or something upwards. So there is at least half a dozen of them to wade through for each exam. So I think if you're well on track with your study, it's a good resource to use. If you sort of feel like you haven't really covered a lot of areas yet, then I would probably focus on still honing that breadth of knowledge. And just as you're reading through new conditions or rehashing common things that you're not sure about, just make sure in your head you're saying, what are the 4 most important features on history? What are the common examination findings for this condition? What investigations would I order? And how would I manage this patient? And the management can be medical, pharmacological, non-pharmacological, etc. And the other thing that seems to come up frequently, I haven't read all the exam reports, but I have read a few of them. And what seems to come up is there's always some sort of emergency management question. And I'll talk a little bit more about the curriculum in a minute, but I think it's really important to sort of know your your basic life support, know your management of anaphylaxis, severe asthma attack, and think of other things that may present into the to the GP. So someone overdosing, they could be brought in. Someone with diabetic ketoacidosis, usually they can often present to the GP first time. And so just know a little bit about what you do in the emergency scenario, and especially because in my exam, I think there was 3 or 4 questions that they set in a rural area, so quite a good percentage of the questions. So yeah, it might be easy to say, diabetic ketoacidosis, I just like do a blood sugar and call the ambulance. But what if you were in a town 200 kilometres from the hospital? What would you do then? So I think when those emergency management scenarios, I think always think of it as if you're in a rural context. For those of us who work rural, it's a bit easier. For those of you who don't, that's a really good mindset to get into, and talk to friends who work rurally, or talk to your supervisor about it. But that's how you should learn those emergency management questions. The beach data. So there is a lot of talk about that's where all the questions from the exam come from. And I think that's a very easy thing for RACGP to say, because if you look at the beach data, this just comes from chapter 7, a list of the most common problems. They're all very obvious things. So obviously lots of the questions in the exam to some extent cover these areas, but in my exam there was plenty of questions that didn't cover these things. So I think when you're studying, obviously these are the conditions that present most commonly to GP. They're the ones you should know the most about, but don't get excited and think, oh, like there's a long list of topics there, that's all I need to study because that's all I'm going to get asked about. That's definitely not true. And sometimes they'll ask something random about one of these conditions. So, back pain often might be actually like a drug seeing type patient, or you might get a question about antibiotic use in acute bronchitis, or I don't know, what else have we got there? What are the ethical considerations of giving contraception to a 14-year-old girl who's unaccompanied by her parents and admits to having a relationship with a 17-year-old person? So I think it's easy to look at that list and be like, yes, that's my study list done. But I would not stop at that list. And I would not be surprised if you feel like more than half of the exam questions are not taken from that list. Data also is no longer being collected. So at some point, they're going to have to stop using it for exams because at some point it will be out of date. But I think I flicked through the ESO modules again, and I think they're still talking about using it. So I don't think they've changed the modules. So hopefully they're still telling the truth. And the other thing I think that sort of we don't really look through much in RACGP, especially when you compare it to ACRM, is the curriculum. I don't know if any of you have ever tried to wade through the curriculum. I certainly tried before studying for my exam and found it just very difficult. It's a 90-page document from 2016, and it's very, very wordy, and it's hard to see how it's relevant to study. But I do think that they will start, and I mean, even the exam I sat, they did have a lot of areas that were not out of domain 2, which is the professional knowledge and skills. They did have a lot of domains, organisational and legal dimension, population health. That bottom one, sorry, that you can't really read, domain 4 is professional and ethical role, and obviously communication. So lots of your questions, like that diet question, is not really a bit of knowledge, but a lot of it is communication as well. So I just thought I'd break down the curriculum a little bit because for those of you who have a bit of time up their sleeves, it may be worth having a little quick flick through. And for those of you that are really sort of just starting to study, it's probably not worth the time spent going through it, but is worth at least having a little look at those. I'll just go back at those key areas. This slide picture didn't project very well, but these key areas under each domain. So domain 1, for example, Part 1, general practitioners communicate effectively and appropriately to provide quality care. And then Part 2 is effective health education. We are able to promote health and wellbeing to empower patients. So it's a bit of a wordy statement, but that definitely means they can ask you any question they want about empowerment, health, education, etc. So when you first open the document, that star comes up quite early in the piece, and then you'll scroll down and it will break down these sort of core skills listed under each domain and then break them down even further. So I think what's important to recognise is the core skill on that very left-hand side of the column, and there'll be 2 to 4 depending on the name, and then the rest of it you can kind of ignore except this middle box. So that's general practice under supervision. The box next to it, pre-general practice, is sort of medical student or pre-GP training years, and then the other one is your lifelong learning. So the lifelong learning talks about reflecting and developing, more skills, providing mentorship, reviewing your practice, doing audits, that kind of thing. That middle box is the ones that you need to focus on. And I just took the first snapshot. It's probably doesn't give the best examples, but it does give some there. So if you go down to CS111B5, so the bottom box of that highlighted column, effectively utilise professional interpreter services. So if you're reading through some of those things and you see, oh, I don't know anything about using professional interpreter services, then you can scroll down to the text, look up that 1115B and just have a quick read of that paragraph, and it might give you some tips. And so I think if you do have time to flick through the curriculum, go to the tables, look at that central column, highlight any areas that you may sort of think, oh, I actually don't know a lot about that, and then you can read those specific areas in the text. And that should definitely speed up trying to wade through the document. There is a couple of really useful areas in the curriculum, and I've just sort of screenshotted a couple of them. So this may be not so relevant for the AKT and KFP, but definitely for the OSCE, and it's something that can come up. This is a list that they've given of procedures that GPs should know a little bit about. So first, half of it is about decision making. So choosing the procedure, communicating, informed consent, safety, including infection control, and documentation. And that is almost just as important as knowing how to do the procedure itself. And they've just given you a list of procedures that I think GPs should know about. And so that's sort of all fair game. And then I already talked a little bit about the emergencies, but there is also a list. They've sort of said, in the table, they said management of the significantly ill patient. And these just basically give you a list of different ways to categorise them. So for paediatric women or end-of-life emergencies, for body region, for chest for brain, mental health, abdominal pain. And I think it's therefore fair game to actually ask you about any of them. And as I said, like, you don't need to know like the exact the exact medical treatment for Stevens-Johnson syndrome, but you do need to recognise that it's an emergency and know the basic emergency management. So obviously they can lose a lot of fluid. Obviously it's very painful, and obviously they're going to need tertiary level care. So if you're in a rural area, you would have to transfer them. So I think it's worthwhile just trying to flick through the curriculum document to try and pull out some of these lists and try and highlight some areas that you may not be familiar with, may not have thought of covering, and especially for those who are sort of honing their study now as it's getting closer. I think that's somewhere that you can go to for sort of more ideas.